Sanhita Mukherjee. In this video, I will talk about learning process, learning domains, and principles of adult learning. The learning objective of this video will be what is learning, role of teacher in learning, what is learning spiral, principles of learning, how to improve learning skills, what are the learning domains, and principles of adult learning. Learning is a process resulting in some changes or modification in the learner's way of thinking, feeling, and doing because of practice. So after seeing this video, if there is some changes in or modification in your thinking, feeling, or your doing, so that you have learned something from this video. So this change, it may be temporary or it may be permanent. Okay, so by practice you can make it permanent, and the more effective the learning experience is, the better is the learning. So the effectivity or effectiveness of the learning experience, it matters, it improves the quality of learning. According to learning theories or principles, we can say that when we give some input and we expect to get some output, so there will be some amount of processing in between, and that processing is nothing but the processing of learning. Let's take one example. So what is the goal of our medical education? According to National Medical Commission or NMC, the goal of medical education is to create a competent Indian medical graduate. Now, do you think medical education is a system? What do you think about this instrument? This is a mixer grinder or juicer, what you can say it is. Now, can you call it a system? If you know that it is a system or not, then you can understand whether medical education is a system or not. So what actually we do in this system or in this with this instrument? We give something into it, we run a process, and we get some output like this delicious juice over here. So the process is input, then running a process, and the output. So this instrument is a system, and similarly we can call our medical education is a system. Why? In medical education, what are the inputs? Inputs are the new entrants, the NEET PG cleared first year students. Then we have the inputs like the teachers, the college infrastructure. So all these are input. Then we run a process, the process of teaching, learning on the basis of our curriculum and syllabus. And after the process is over, we expect to get a competent Indian medical graduate. So in this system we have input, we run a process, and we get one output. So medical education is a system. Now, do you think this system is complete? In this picture what I am showing, is it complete? Suppose I have made a delicious looking juice and I have offered this juice to my tiny daughter at home. Her reaction may be this, and her reaction may be this too. If her reaction is yummy, then I will repeat the process. If the reaction is not yummy, then I will try to change, I will try to correct it. So what is important here? Just not the input, processing and output, but also most importantly the feedback. So in a system we should have input, process, output and the feedback. So in the educational system we know that we are running a process in this way. The first year students are entering, and we are running the teaching learning method with the curriculum and syllabus, and the graduates are coming out. But the graduates, whether they are competent Indian medical graduate or like this has to be known by the feedback. Now, who will give this feedback in case of Indian medical graduate? Their university result will show their feedback, will give the feedback. Community will give the feedback whether the doctor is competent enough to act as a first care delivery system, and it will be also given by the statistics of medical errors and the media flash. So we are clear about the input, process, output, feedback, and from where we are getting the feedback. Now we want to focus on the role of our medical teachers like us in this medical education system. There are several roles the teacher need to play. A teacher should be a facilitator, a teacher should be a assessor, planner, resource developer, information provider, and most importantly, teacher should act as a role model for the student. Now, in spite of all these roles, as in this video, we are discussing about the learning, the process of learning and the principle of learning. So I have showed you what is learning. The effective learning experience or improves the quality of learning in my previous slide. Now, this effective learning experience, it is in the hand of the teacher. Provision of effective learning experiences, it depends on teacher. Depending on the ability of teacher to provide a meaningful learning experience, the quality of teaching, it will improve. It will vary. So there is another important term, that is a learning spiral. So learning is a cyclical process. When and where we get the new experiences and how often these experiences are repeated, and it is referred as the learning opportunities. A new experiences or new piece of information may be first heard or seen during a lecture, or it may be now accepted or analyzed as something relevant or important. So the first is the experience, second is the registration of that and analysis and the reflection. On reflection, it may seem to be significant for some purpose. For example, if I am giving this lecture on the learning process, first you will experience it, then you will register and analyze it, whether this lecture is what I have learned, what I have heard. Then you will reflect that whether some part of it is significant or helpful for me or not. Then comes the recall. It may be spoken aloud or written or drawn on a paper, analyzed to be incompletely recalled like this. And then you will try to apply it to your own situation. And when you will try to implement it, you will get some new experiences. And that will complete the cycle of your experiencing by doing. So learning is a spiral process. First you listen to it, you register and analyze and reflect, then you implement it. While implementation, your experience becomes more concrete and ultimately you learn the process. Now, what are the principles of learning? So if we know the principles of learning, then as a teacher, it will be easier for us to facilitate our students, because if we know in which process our students learn. According to Alfred North Whitehead, Learning is the acquisition of a knowledge base used with fluency to make sense of the world, solve problems, and make decisions. So knowledge is not only the acquisition of it, but also to implement it, to solve some problems and to make decisions. And he also said that knowledge that is just acquired without being utilized is what he called it an inert idea. So if the knowledge that I have acquired, it is not implemented, it is just an inert idea. Now let us consider some basic principles of learning. First is the relevance. Learning is better with subject matter of immediate relevance. When the relevance is remote or obscure and the student has to learn with a belief that the knowledge perhaps might be of use someday, then the learning is difficult. That is the reason our learning just before the night before the examination, it is very high, because we know that in the next day I have to appear for the exam. So this immediate relevance improves our learning process. Second point is the sequential learning. We learn by progressing from simple to complex matter and from observation to reasoning. For example, if I show a child that way, if a candle is burning and if I place a glass over it, the fire will be put out. So first the child will observe it, then will ask why it is happening. So first is the observation, then the reasoning, and if I then explain the matter, so it will be registered in his or her mind for permanently. So this is the sequential learning. Followed by the cumulative learning. We learn by building on what we already know. An implication of this is that prior knowledge needs to be activated to build a new learning. Now Edward Thorndike, he has elicited some laws of learning. He told that just as the science and art of agriculture depend upon chemistry and botany, so art of education, it depends upon physiology and psychology. So psychologically, we have some theories of learning. Psychological learning theory has four different components. One is the cognitivism, second is the behaviorism, third is the humanism, and the fourth is the socio-culturalism. Physiologically, we say that we can divide the learning and the memory into three forms. First one is the sensory memory or the working memory. Then there will be the short-term memory, and then there will be a long-term memory. Okay, so first one is your sensory memory or the working memory. This working memory, it is equivalent to the RAM of the computers. Okay, so we know that when we are writing, we are preparing the PPT, if it is not saved or if we switch off the computer, then your document is lost. So this working memory, it lasts for around 10 to 15 seconds. Then there will be the short-term memory. This short-term memory, as the name indicates, that it retains information from few minutes to few hours. Now, the information of this short-term memory, it will be lost if there is no regular rehearsing, okay, or if it is not transferred to the long-term memory. Now, how can we convert this long-term memory? This long-term memory is nothing but the hard disk of the computer. So when it is stored in the hard disk, okay, so it is stored relatively permanently, and most importantly, it can be retrieved. if stored properly, just like saving a Word file at a proper place. So, and you know that where you have stored it, so you can retrieve that data. So this is the long-term memory process. And this is the long-term memory in the hard disk we have stored in this way. Now it is interesting to note that there is no delete function in the human brain. So what you have apparently forgotten has not gone anywhere. Rather, it is buried under new informations, and with effort and practice, it can be retrieved. So, the simplest way to improve the retention of information is to transfer it from the short-term memory to the long-term memory. Now, how we can improve the learning skills? Robert Gagne has a theory of hierarchy of learning. In that theory, he told that there are so many steps or stages of learning, and more improved learning is possible by this problem solving or the concept learning in this way. So we can say in a nutshell that the improvement of learning can be done by 4 steps. One is the active involvement. Learning is more effective with an active involvement of learner in the process. For example, small group discussion is effective than lecture class. So, and it is seen that we only 10% of knowledge we retain when we only read, 20% retained when we only hear, 30% we retain when what we see, and 50% is written when we see and hear. 70% is written when we say and write what we have learned, and 90% of it is retained when we do it by yourself. So active involvement or active doing is important to improve or promote the learning. Now the second point is the formative assessment and the feedback. Learning being a process of acquiring new knowledge and skill, it enables the student to do something that they could not done before. Now providing feedback on their performance, it helps the students to learn better. So, and also the formative assessment, that is the assessment that helps in the formation or improvement of the learning, also helps the process of learning. And the third point is the driving of assessment. The system and process of assessment has a direct effect on learning and learners. Students are generally blamed to be examination oriented, given the fact that students learn for the sake of examinations. But assessment has some good implications too. Assessment can be utilized for better learning. If more questions are asked regarding the common health problems in a lecture class, in the group discussion, that improves the learning. And the fourth point is the social and cultural ethos. If the social and cultural ethos or values, it is degraded, then there will be a degradation of learning. Because medical education is also no exception, that if the non-deserving candidates, they are scoring better, and it develops a kind of negative behavior. So this social and cultural ethos can also affect the process of learning. So this is the learning cycle. So here we can say that there must be a complete alignment between the learning objectives, the teaching learning method, and the assessment. What we want to assess in the student, that thing we will actually put as the learning objectives, and we will make the students learn by different teaching learning methods. So this is known as the learning cycle. Now come to our next topic, that is a learning domain and the Bloom's taxonomy. This is a very important concept. So the William Osler told that the practice of medicine is an art, not a trade, a calling and not a business, a calling in which your heart will be exercised equally with your head. So the meaning of this quote we will understand in our next slides. Now, can you enumerate all the activities that you undertake when you go to your OPD or outpatient departments? You take history of patient, you make diagnosis and write prescription, you explain the treatment to the patient, you reassure the patient as well. So now, can you categorize all these activities in some other way? Yes, we can categorize it. Some is related to the knowledge, some is related to the skill, some is related to the communication. So in fact, in every doctor-patient interaction, most of the activities are divisible into these three domains. What are those? One is the cognitive domain, that is the acquisition of knowledge. Domain 2 is the affective domain, that is feeling, emotions and attitudes. And domain 3 is the psychomotor domain, that is the acquisition of skills. Benjamin S. Bloom, he actually proposed that the cognitive domain, he was a citizen of United States and he was an educational psychologist. He was an employee of American Educational Research Association. He proposed mostly this cognitive domain or the domain of knowledge. Now this taxonomy of cognitive domain, affective domain and psychomotor domain, it was immensely helpful for us because the use of taxonomy as an aid in developing a precise definition and classification of so many vaguely defined terms. So when I am going to teach my student, some topic will be in the cognitive domain, some will be in the psychomotor domain, some will be in the affective domain, and the teaching learning method will be different. The assessment procedure will be also different, and all should be aligned properly. So just saying that thinking and problem solving, this vague term, this taxonomy, this discrete taxonomy of cognitive, affective and psychomotor domain, it has enabled us to form the learning objectives. According to the objectives, to plan the learning, teaching learning methods and also the process of assessment. So we can say that to become a competent Indian medical graduate, we need to use our brain to acquire knowledge. We need to use our hand to acquire the skill, and we need to use our heart to communicate with the patient and the relatives. So this cognitive domain was proposed by Bloom, and the skill domain was proposed by Dave and modified by others, and the heart or the affective domain was proposed by Cartho. The knowledge, skill, attitude and communication, they can also be called as KSAC. Now all these domains, that is the cognitive or knowledge domain, that is the skill or the psychomotor domain, and the attitude and communication, that is the affective domain, they can be further subdivided into different hierarchy from lower level to higher level. In case of cognitive domain, it may be the knowledge, comprehension, application, analysis, like this. In case of psychomotor domain, it may be like imitation, control and automation. In case of attitude domain, it may be, or affective domain, it may be the receiving, responding, like this. So we will discuss it with example by one by one. So we are starting from the cognitive domain. First, for example, I am discussing about the treatment of TB with the rifampicin. So suppose I am talking about the knowledge domain where we consider the recall of data or information. The example will be the enumerate the 5 side effects of rifampicin. Just naming the side effect of rifampicin, this kind of knowledge is a recall. Then if I ask the student explain the mechanism of hepatotoxicity of rifampicin, then I am talking about the comprehension. It is a bit higher level where we expect the understanding and explanation of the students in his own words. Then further higher zone, if I ask the student to calculate the dose of rifampicin for a 20 kg patient, then it is the application. That is use of concept in a new situation. Then further higher level is the analysis. If I ask the student to discuss the advantages of using rifampicin in the initial treatment. Here actually I want the student to distinguish between the facts and the inferences. And the next higher level is the synthesis. If I ask the student to discuss characteristics of drugs which prevent development of drug resistance, so we want to build whole from parts and derive meaning from the new whole. And the highest, the most high level of this cognitive domain is the evaluation. Then we are asked the student to select the most appropriate drug for a drug resistant TB. Okay, so here the student is judging the value or there is a worth of action. So in this way there are several hierarchy of the cognitive domain. Next come to the skill domain or the psychomotor domain. The lowest level is the imitation. Okay, so teacher is demonstrating the student and the student performing intubation on a dummy. So here actually just imitation or copying the action of the teacher, it is done. It is the lowest level. Followed by the control performing intubation under supervision. So here the performing an act according to instructions. And the highest level is the automatism, that is the intubating a patient in a busy emergency room. So performing the series of articulated acts. So these are the hierarchy of the skill domain or the psychomotor domain. In attitude or affective domain, the lowest level is the receiving. That means paying attention to a mother who is crying in the ward. Suppose a mother is crying. So paying attention to her, it is the receiving. Then the second thing is the responding. That is trying to find out why she is crying. Now after responding, the third thing, the next higher level will be the valuing, saying soothing words to the mother. Then there will be organization. So realizing the grief is inevitable on ailment of the child. So it is a clarity of the issue with no conflicts. And the most higher level is the value complex, that is showing to the mother that we care for her grief. That is internalizing the phenomena. So these are the hierarchies of the attitude or of affective domain. We have already discussed what is learning, what is the role of teacher in learning, what is learning spiral, what are the principles of learning, how to improve learning skills, learning domains and their hierarchy. The next thing that we are going to discuss is the principles of adult learning. Now, what are the principles of adult learning? We will consider our MBBS students as the adult learners and we will try to implement these principles on them. So these are our adult learners. And do you think that adults can learn? Because adults have so many issues. They will ask, why do we have to learn all these things? These learning process, learning cycle, principles of learning. Then in faculty development program, people often ask this. Now, do you have any proof of this? You are talking about all such things. This is another thing. And we feel so much uncomfortable. The food is not good, the AC is not working, and the coordinator is very rude. So we have so many issues. Okay, and I am not feeling well in this place, and I don't want to learn. So adults have many more issues than the actual students. So the basic difference between the adult learning and the learning pedagogy is that when we have learned the bicycling in our childhood, what was our goal? Just it was a fun. My so many friends are learning bicycling, so I will learn it. I will go to tuition with my bicycle. Okay, so it was a kind of enjoyment or fun. But when I had started learning driving, the situation was different. Okay, so there I have a need. I have to go to my workplace early. I uh, I have to drive in a busy place, and so many needs are there that has motivated me to learn driving. So this is the basic difference, that one is the need based learning, the learning based on relevance, another is not that. So that is the basic difference between the adult learning and the pedagogy. The andragogy or the adult learning, it was initially coined by the Malcolm Knowles. So in my previous video where I have discussed about the self-directed learning, there also we have got this name of this famous person, Malcolm Knowles. So he has introduced a term which describes the science of helping adults to learn. So according to book, the definition of andragogy is the all form of learning undertaken by adults after having initial education and training, however far this process may have gone, for example, including tertiary education. Now, what are the differences between the pedagogy and the andragogy? In case of pedagogy, learners are dependent. In adult learning, they are independent. In case of pedagogy, learners have less or no experience to share, hence teaching becomes didactic. Here, in case of adult learning, the learners are experienced, hence teaching involves discussion, problem solving, etc. Teachers are required to direct the learners. Here, the learners are all self-motivated. So teachers act as guide or facilitator. Now the learning is curriculum oriented. Here the learning is a goal oriented. Now in case of pedagogy, the motivation is external, and you have to reward or punish the student to improve their learning. Here the motivation is internal. In case of pedagogy, they likely to accept the new information. But adult learners, they will try to question. They will want the proof before accepting it. Then in case of pedagogy, application of learning is deferred. Here it is the application is immediate. Pedagogy is the future oriented and andragogy is result oriented. Now in case of children or the pedagogy, so what they usually learn whatever we tell them to learn and view the learning content as important because adults are telling them to do it. In educational setting, children are much alike. Now in case of adult, learn what they perceive to be valuable. The adults have different ideas about what is important to learn, and groups composed of different age, background and experience, that is also a difficulty for the facilitator to teach them. And in case of children, readiness to learn linked to development. They learn because it will be of use in the future, and they are externally motivated, that is motivated by grades or praise. Whereas in case of adults, readiness is to learn linked to the need. I need to drive a car, that's why I am learning it. Adults are more concerned about immediate applicability. After ending the course, end of the course, will I be able to drive? Then it is the learner is internally motivated, self-esteemed, and mm, there is a sense of achievement. Now, usually the adult learners, they build on the existing knowledge. Okay, so in your class, you can use this technique on their already known things. You can build up the knowledge. For example, you before starting the class on the myasthenia gravis, you can show the picture of this person. That is, do you know this person? Okay, so do you know what clinical condition he is having? So that may be a kind of inset induction. Or do you know this person? Do you know that he was having the Addison's disease? Or you can say the story of use of synthetic insulin to this Elizabeth Hooke, who was a 11 years old little girl, was about to die, but when Benting and West, they have given her the synthetic insulin, she has recovered, and ultimately she lived her life up to say 70 or 80 years. Okay, so by this knowledge or experience, by showing these pictures, asking the students to know about them, you can build up on their knowledge. Okay, so similarly, we can give the example of Henrietta Lacks for the HeLa cell lines. Okay, so building on the existing knowledge and creating an interest on it, it will help the adult learners. Now, another important thing is that the environment must be non-threatening, and it should be comfortable, and there must be flexibility. The punishment or something judgmental, that will hinder the process of adult learning. Another important principle of adult learning is adult education is relevant. It should be relevant. Okay, so if the new information, it is relevant to his performance in the examination or workplace, then the adult learner will get it more quickly. Another is the participatory. The adult learner should be engaged in the process of learning. More active learning, more participation, more working, more activity will actually enhance the learning of an adult learner. And it should be very supportive. You should not give, your feedback should be very constructive. Okay, so it should not hinder, it should not demoralize the adult learner. In that case, the learning process will be hindered. So the learners receive positive reinforcement such as praise and encouragement. Learners receive constructive feedback to help them to improve their knowledge and skills. So we know that medical education is a system where our inputs are our students, our teachers, and the processing is just like this. Learning process is done by this curriculum and syllabus and teaching learning method, and we know that how can we improve the learning and help the student to retain that knowledge, what are the different domains of learning, and we also know that the output is not enough until and unless we are getting the feedback. So accordingly, we can change the input so that we can get our expected result. And the adult learning principles we have also learned. It should be in safe and non-threatening environment. Learner should be active contributor, and it should be built on existing knowledge, and the relevance of content is very important, and participation, problem-centric approach, support of self-directed learning, and the constructive feedback, all are the parts of these components of adult learning principles. And the adult education fosters opportunities for self-directed learning. We will have a huge discussion in the self-directed learning. I did in the previous video. So in case of self-directed learning, actually they take the the learners take the responsibility of their own learning. So if we follow the adult learning principle, then we are actually helping the student to become a self-directed learner. In the long run, he or she will become a lifelong learner, which is very much needed in medical education. So adults retain 20% of what they hear, 30% of what they see, 50% of what they hear and see, 70% of what they hear, see and say, and 90% of what they do. And they learn best when they feel valued and respected, and their role is active and not passive. So learning should be reinforced in case of adults. Learning application should be immediate, and the better learning occurs in small groups, and the trainer values their contributions. These are my references.